So good morning, everybody. Welcome, and thank you for joining us for today's webinar on tornado aftermath and disaster response insights. My name is Samara Mentley, and I'm a project coordinator here at the National Environmental Health Association, or NEHA for short, and I'm going to be your NEHA host for today. Today's webinar, you're going to have the opportunity to learn about the tackling that went behind the complex environmental health issues of the tornado, and also the support that went along with the community through the recovery process. To begin today's webinar, I am going to provide a brief overview of who NEHA is and the things that we do. I'm also going to provide some details on our 2025 annual education conference. We are going to have an introduction to our presentation and then a panel session. The presentation and panel will then be followed by a Q&A session, which will allow you to ask your questions to our presenters and panelists. So with that, allow me to cover just a few housekeeping items before we get started. This webinar is being recorded. If you do have any questions for our speakers during the presentation and panel session, I encourage you to use the Q&A box to submit your questions, and we will address them at the end of the presentation. At the conclusion of the webinar, you will all receive a link to partake in an evaluation survey to provide some feedback and comments for us to learn from. So for those of you who may not be familiar with NEHA, I'm going to provide a brief overview of who we are. We support environmental public health workforce. And as an association, everything that we do is to build, sustain, and empower environmental public health professionals so that they're equipped and prepared to protect the health of communities across the country. We support environmental public health by continuously providing the most up-to-date trainings, tools, and resources to the workforce who specialize in so many different fields that are considered environmental public health. NEHA is focused on increasing the knowledge and the skills across all of our fields to build upon our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our very large online library of trainings, seminars, available tools, and resources, we also have our annual education conference, our AEC, which includes multiple sessions focused on many different fields of environmental public health. The NEHA's Preparedness Committee's mission is to serve as a resource, not just for NEHA, but for all EPH professionals in preparing for, responding to, and recovering from emergencies and disasters in order to minimize death, illness, and injury and create a more resilient community. The committee supports NEHA's disaster management activities in a number of ways. For example, like we're doing now, we deliver timely webinars on topics that are relevant to current disaster readiness needs. Our committee is involved with resource sharing. They've worked with identifying and reviewing different resources to support disaster readiness work, and also our SME guidance and support for all of our NEHA disaster readiness initiatives and projects. So speaking of our annual education conference, our AEC, the call for abstracts for our conference is September 27th, 2024, which is tomorrow. It's an opportunity for you to share your expertise and showcase all of your research, your projects, and your innovative practices. It gives you a chance to be a part of the conversation and contribute to advancing the field and sharing your knowledge with your peers. It's also an opportunity to engage and network. You're going to have an opportunity to present your work that provides a great chance for you to connect with other professionals in your field. I'm now going to introduce today's facilitator, Carla Shoup, who's also a member of our Preparedness Committee. Carla Shoup obtained her Bachelor of Science degree in zoology from the University of Washington and her MPH from the University of Nevada, Reno. She has 18 years of experience as an REHS and has been managing inspection teams for aquatic health institutions, child care, body art, and plan review for 6 years. Ms. Shoup is currently serving as a mentor for NEHA's Environmental Health Leadership Academy. She also loves environmental health as a career path and wishes she found it sooner. So Carla, whenever you are ready, the floor is yours.
Great. Thank you, Samara, and thanks to everyone for attending. At this time, I'd like to introduce Dr. Mike Gamble, who's going to kick us off with some background information on the tornado event that impacted Sullivan County, Indiana. Dr. Gamble has served as the Sullivan County Health Officer since 2017. He's a graduate of Indiana University School of Medicine and Auburn University School of Business. He's a fellow of the American Academy of Family Physicians and the Academy of Emergency Medical Services. He holds a certificate of knowledge in clinical tropical medicine and traveler's health. He's also a member of NEHA and holds the REHS-RS credential. Welcome, Dr. Gamble.
Thanks. So I'm going to give you the background and kind of information from the perspective of a tornado response that affected a small rural place. I represent the local health department in Indiana, in Sullivan County, Indiana. So Sullivan County is a small rural county. It's not a frontier county. There's 20,000 people there, but the biggest city is 4,000 people. So really, it's mostly a conglomeration of rural farmland and small towns. There's one small critical access hospital. On a good day, there's only 3 ambulances, and it's mostly rural volunteer fire departments for emergency response. So that kind of sets the setting for the area that we're representing. The topic of tornado response really fits well for emergency preparedness. I'm going to talk a little bit more in the realm of the whole health department response, though. Part of that is environmental health, but we also represent other parts of public health, including the public health nurse, vital records, certainly food safety, and on-site sewage is in the purview of environmental health. So on March 31st in 2023, an EF3 tornado traveled 13 miles through Sullivan County. There were 155 mile-per-hour winds. It damaged 150 homes, and there were 3 deaths. You can see from the next slide a picture of kind of the devastation in the center of this. We've all seen lots of pictures, but when this is in a local event, it really hits home because it affects your local friends, family, neighbors. On the next slide, you can see additional damage pictures. This is really interesting. On the picture on the right, the street, Silver Street, was kind of a dividing line. On the south side or the right side of this photo, there was basically devastation. Everything was just shambles. And on the left side, where you see the Little League ball diamond, the houses basically were standing and they had damage, but not major damage. So the tornado really kind of picked this street as a dividing line for our county. And this could have been a lot worse. It could have been a mile north and hit our high-rise apartment building. It could have hit our single-story hospital, which is on a slab of concrete. It's a single-story place. So we did not have damage like that, but it did affect a lot of people. So really the question begs, when it happens, are you ready? And that's the purpose of emergency preparedness planning. We all deal with that, and that's the purpose of this committee and this presentation. But when it really affects your local jurisdiction, your local family, friends, it is a little different perspective. So this tornado happened during spring break, which is all plans go away, as we all know, in an emergency. So in my small health department, I was in Florida, my public health nurse was in Florida, my food inspector and administrator was in Florida. Everybody in Indiana goes to Florida for spring break, obviously. So we had limited staff there. The EMA was in a similar position. The EMA director was also out of town that night. The most helpful thing that happened to me was immediately after the tornado hit, the first morning after, I received a call from the Indiana Department of Health. Holly Rose, actually, who's on this panel, called me and she said, I've been through this before. I was working in a small health department and we had a tornado. And here's what is going to happen. She said, there's going to be chaos. And even though you try to follow your plans, it's really just going to be mass chaos. And then you're going to have a lot of volunteers, but there's going to be no organization. It's going to be very difficult to organize the volunteers. It's going to be difficult to get them on task. And the volunteers are going to really be an issue that has to be dealt with. It's going to be possibly a problem. She said you need to look up for pop-up food vendors. The last thing you need is to have these people bring food that then starts an infectious disease, foodborne disease outbreak. And that was true. A lot of people the first day, the second day, there's people alongside the road with a grill passing out food. They're trying to help. And then she said, you're going to be overwhelmed with donations. And that is, I've got some pictures later of that. And the donations were a really big deal. So in the local public health department, we kind of segregate our duties in environmental, food, and on-site sewage, septic. We have a vital records department. We have a public health nurse who does mostly immunizations. We have an emergency preparedness coordinator. The team started with our emergency preparedness coordinator. So I think a lot of people on this call are probably really dealing with emergency preparedness. And she took the lead and really did a fabulous job for us. I'm going to put some little caveats in here that are just interjections. One is, from the very beginning, I told Mary, we would need to go out in twos, not go out by ourselves. And this came to help us later when people told, the rumors start and they say, oh, the health department said this and the health department did this. And that wasn't really the case. They weren't things that were true. And the fact that we were not by ourselves was helpful. The kind of the story started on the next slide. The emergency preparedness coordinator was in the command center, which is in our emergency management agency. And the first night was total chaos, like Holly suggested. Communications are something we always talk about as being a problem. In fact, our 911 dispatch did not have power the first night because the generator didn't work. So all of the dispatch for this initial search and rescue operations had to be done by handheld radio from a secondary dispatch center. So communications obviously is an issue. We've since added extra phones, satellite phones, so in case the cell phone towers don't work, we have access to a different way to get out to speak to our statewide emergency operations center. Marianne, the preparedness coordinator, said, she offered, what supplies do you need? And they all wanted, how are you going to deal with tetanus shots? The supplies that they really needed that we did not have enough of were goggles, safety glasses, heavy duty gloves, and flashlights for the search and rescue operation. We had some of those, but certainly not enough for all of the rescuers that were there. So we've since added in our supplies extra things like that. The vital records is an issue because people need their birth certificate to go to the bank to get a driver's license. They need an ID to get a birth certificate. So this is a chicken egg problem. There's no internet. How do you deal with that? So you really need to have a backup plan for how you're going to deal with vital records. And it seems simple, but it's actually kind of complex. For example, the state only had one backup stamper, the certified birth certificates, and they had 2 communities to go and print birth certificates for in the one-stop shop. Something simple like that can be an obstacle. In food safety, we really wanted to focus on the pop-up food vendors, and we dealt with those. We really wanted people to be using food from approved sources. We wanted to make sure the food was safe. We chose not to charge for permits for mobile, but we did go and do a formal type of inspection for those people. An extra caveat to that is we didn't charge them. We sent thank you notes to those people because they came from out of our community to support the community, and we wanted to be able to let them know we appreciated that. The local operators really didn't have a lot of backup power, and the power was off for a long time, so they lost a lot of food. And we really needed to make sure that they, got rid of the food, didn't try to use the food that had spoiled or had not been held at temperature. And their freezers, their refrigerators all had to be checked. So we did a lot of efforts to make sure the food was safe. We had outside people bring truckloads in non-refrigerated trucks of hams and turkeys and meats, which obviously was a problem. That you just how you deal with that. Anytime you get rid of somebody's food, they're unhappy if it's donation food, but you don't want people to get sick. The State Department of Health actually came and helped us do some food inspection. They were a good resource. One thing we learned was that baby formula, they really were worried about baby formula that was expired. That was not high on our list, but that was really the highest thing on the food safety list for the state inspectors. And then there were lots of donation centers. Lots of donations came. The center had to be moved a couple times to a bigger and bigger place. Some of this is useful, some is not useful, but it comes in. You got to have a place to store it. You got to have a place to sort it. It takes a lot of manpower. The septic systems were a big problem. Heavy machinery was used to clear the debris, but yet if you didn't mark your septic system off, the heavy machinery would ruin your soil absorption field. And we really struggled with how to help people prevent that. And we decided that the emotional state of the people at the time was not such they wanted to hear about their septic system. There were deaths in the community. They lost all their house, all their possessions. Some of them basically just blew away. So we really didn't start that right away. We ended up having to replace 18 new on-site sewage installation systems. A lot of these people were on the city sewer as well. One thing that you don't really think about, but your loss of landmarks. When a tornado comes, the trees that have been there for 30, 50 years are gone, the fence rows are gone, the houses are gone, the buildings are gone, there's nothing left. So people didn't really even know which house was which. How do you find a place? How do you know where you're going? So the city actually hired a firm to come in and do a simple survey, and they put these signs up that said, this is the parcel lot number for this house number, so people could kind of see where they were supposed to be until they got the real property lines figured out. Our public health nurse did a little bit with some emotional support, some psychological aftermath and counseling. She was our coordinator with our one-stop shop, and she did some tetanus vaccine and some kind of educational things. In the end, our governor actually put together state agencies so they would come together. They had the one-stop shop, which had the Bureau of Motor Vehicles there to help people get driver's license, ID cards. They had Department of Health to help people get birth certificates. They had all of these other organizations. They had the FSSA to help people with their Medicaid. The Department of Insurance was there. Lots of different assistants. So people could go to one building, talk to all of these offices, and get all their business started at one time. So that was a big benefit. In the end, the last picture kind of sums up the state of what happened. This picture really hits home for us because this was one of our nurses. She had a log cabin that was a very nice log cabin on the top of a hill on the 20-acre field. And this is her log cabin, her house, her home, spread across that 20 acres and basically in splinters. So she had to rebuild, as did lots and lots of other people. So that's kind of the summary of where we started. And then I think we're going to have the panel take some questions and add some other insight.
Great, thanks, Dr. Gamble. Very interesting. So now I'm going to go ahead and introduce the rest of our distinguished panel. Holly Rose, who you heard about in the presentation, is the District and Local Readiness Manager for the Indiana Department of Health Division of Emergency Preparedness. Holly oversees and manages the Public Health Emergency Preparedness Program, Medical Reserve Corps Program, and the Hospital Preparedness Program. Prior to coming to IDOH in December of 2020, Holly was the Administrator, a Public Health Preparedness Coordinator, and Environmental Health Specialist at Ripley County Health Department, where she began her public health career. Holly serves as the Terrorism and All Hazards Preparedness Committee Chair for the Southeastern Indiana Environmental Health Association and is a past president of the Indiana Environmental Health Association. Derek Siebold is the Planning and Preparedness Manager with the Indiana Department of Health Division of Emergency Preparedness. He's been with the agency and division for over 6 years. In this role, he oversees the division's planning, training, exercise, and medical countermeasures teams. Throughout his time with the division, he's been involved in numerous agency responses, including COVID-19, MPOX, and severe weather incidents. His response roles have included ESF 8 liaison to the Indiana State Emergency Operations Center, planning section chief, and medical countermeasures coordinator. Derek holds an MPH from the Indiana University Richard M. Fairbanks School of Public Health and is currently pursuing his Doctor of Public Health degree with a concentration in emergency preparedness from the University of Nebraska Medical Center. Deborah Anderson is a senior emergency preparedness coordinator working for the California Department of Health on the emergency preparedness team in the Center for Environmental Health. She's also an REHS with over 20 years of EH experience at the local level. Over her career, she was employed as a district specialist in 3 different counties and worked in a multitude of EH programs such as land use, water wells, domestic wastewater, food safety, recreational health, and housing. She's a subject matter expert in on-site wastewater treatment systems and overall land use management. So welcome everyone, and thanks for joining us today. So I'm going to start it off with a question for Holly and Dr. Gamble. Can you describe the initial steps your team took once the tornado was confirmed?
So I will speak to that at the local level. Initially, the tornado actually was in the nighttime, in the late evening. So initially, the emergency response starts with the search and rescue function. And my septic on-site sewage inspector is a fire chief in one of the local fire departments. So he immediately went with his fire department to start search and rescue. And they had to use chainsaws to cut their way into the affected area. So the roads were blocked, and they really had to. The search and rescue was a difficult thing at first. And then they needed other search and rescue teams. My emergency preparedness coordinator happens to be also run an ambulance service. She was able to get extra ambulances and search and rescue teams from a couple of cities that came and helped. So that connection was really helpful. That's kind of where we started in the first night was search and rescue.
Did you have like any advance notice before the night that it happened? Like, was there anticipated to have tornadoes in the area?
Not really. Nothing unusual was expected.
Go ahead, Holly. Sorry.
No, you're fine. That's a really good point to bring up. Yeah, so on our end, it was probably around 1, 2 a.m. When, because that's when it always happens, right? When my one of my team members who covers the northern part of the state of Indiana reached out and notified me that our Indiana Department of Homeland Security liaison had contacted our coordinator in that area to ask for her assistance at what they had set up as an alternate EOC. Because I think Dr. Gamble, you mentioned it earlier, even the EMA director was out of town at that time on vacation because it was spring break. So and so that's when we really started wrapping our head around the significance of what had happened. Of course, it's nighttime. There is a lot of chaos. So sometime around that next morning when I started finding out that so many of the health department individuals were not even in the state, I try to keep close contact with a lot of our health departments. I feel like in Indiana, one thing we do well is that relationship building. And so I had known Dr. Gamble, and we've worked on things from whether it's invoicing and grant dollars and attachment A's to hands-on disaster response. So I just picked up the phone and called him and said, Doc, and I was unaware he was out of town when I called him, what do you need? And I didn't even know if he knew, I had all these previous years at the health department at a county level where I had this similar experience. I just let him know what to expect. And that's when he proceeded to tell me of who all was out of town. So I'm sure the interstate's back from Florida to Indiana. I'm glad there was no radar checks, I'll say. But yeah, just really kind of giving them that firsthand. And you can have all the plans in the world. But it's those little details of getting that advice and sharing that knowledge of knowing here's literally what to expect. It's the donations. And I was hoping I didn't want to overwhelm him at that point. However, it's like, okay, here's what's going to happen. And so then we started as well reporting up to our chain of command involving Derek, which he'll speak here all about on planning preparedness, involving our division director, Angelo Soto, letting our assistant commissioner know at that time. Because then we did have another county a little more north that was impacted as well, and started that coordination with our Department of Homeland Security here within Indiana. Yeah, that was our initial first 24-hour steps, I would say.
Great. Dr. Gamble, can you describe how disaster planning is designed and implemented in Sullivan County?
Yeah, so there's obviously multiple facets to that. The emergency management agency is really kind of takes the lead. We have, the local emergency planning committee with lots of partners, including the ambulance service, hospital, fire departments, health department, EMA, lots of other people. From the perspective of the health department or public health, and we have a grant through Indiana that actually funds part of that, and we participate in that. And so we have a preparedness coordinator who is basically paid for through that grant. And then we do a lot of planning as deliverables for that grant, planning and exercises that are required to receive the grant money. So the state helps us with that. And that's kind of where Derek's role comes in.
Yeah, I was gonna ask you to join in on this one, Derek, because I know that's your primary role, if you want to provide some additional information.
Yeah, so really my team in concert with Holly's provide that technical assistance, templates, and resources to support the local sort of readiness elevation. And then definitely at the district level, encouraging healthcare coalitions to bring all their county EMAs, hospitals, EMS, health departments together to really support that local readiness level.
Dr. Gamble, did you have any pre-existing emergency response plans for natural disasters in Sullivan County?
Yeah, we have plans that are prepared as part of that grant program. So we and the EMA have separate plans and combined plans. So there's emergency operations plans, continuity of operations plans, memorandums of understanding. But in reality, in the heat of the moment at 2 a.m, when the 911 dispatch didn't work and there was a really bad disaster, all that kind of falls apart in a way. I think that it really put the perspective to me that we should practice the way it's going to be, and we really need to follow the incident command system. With that, I think that would make things more smooth.
Mm-hmm. Derek, can you describe how emergency services are coordinated among different agencies and departments?
Yeah, absolutely. So of course, at the state level, we have the State Emergency Operations Center for the hub of information sharing, resource requests, and just overall situational awareness. As Dr. Campbell described, the governor's office did decide to establish a one-stop shop, really state agencies coming together to provide those services to the community and bolster them. So everything from birth and death certificates with vital records, TDAP, and I'll get into another incident we had with another severe weather tornado that happened here in the state after the Sullivan County incident. So yeah, all those Medicaid, disaster behavioral health, mental health services from Family and Social Services Administration, both for the responders and the community at large that was affected, and as well as just working with the community on their individual assistance through FEMA, damage assessments, and really the State Emergency Operations Center to be a hub for all state agencies to come together to make sure we have a coordinated effort to support our local communities. And then internally within our Indiana Department of Health, we have a Department of Operations Center. So really bringing together our divisions, executive leadership together to work on the same common operating picture and common goal. So Holly's team, District Local Readiness, as well as our local health services team, really being our pulse with local needs and wants and how best we can support them, engaging our vital records team and deploying them, immunizations if TDAP services were needed. We do also have mobile units that have nursing staff and administration people on hand to augment local capacity. Coordinating with our WIC, whether just working with local WIC service agencies to ensure those continuity of service delivery and benefits are available to the communities. And then as Dr. Gamble referenced, in this instance, we also had food protection staff deployed to help support. I will say, luckily, with the Sullivan County incident, healthcare infrastructure, such as the hospital, long-term care facilities were not impacted, but we did have an incident here with Randolph County where multiple long-term care facilities were impacted. So we had to work with our regulatory team and our long-term care division to make sure all these residents were appropriately placed in sustainable housing for the near future. And I will say that at the local level and district level, our healthcare coalitions were a major coordinating part in that response. With our EMS strike teams that the healthcare coalition helped plan and establish, involving multiple EMS agencies across the district and transferring them to different hospitals across the state, and I believe even into Ohio. So highly encourage people to know their healthcare coalitions, and definitely know your emergency manager. Partnerships are the key to coordination.
Yeah, thank you. So maybe we can do kind of a group discussion about how environmental health is incorporated into long-term disaster recovery. Deborah, would you like to start?
Sure. So in California, we have 62 local environmental health jurisdictions. We have 58 counties and 4 cities. And we are always trying to incorporate them into disaster recovery and into their plans. I think that's never ending. Specifically, what our team does, we go out and we teach local environmental health specialists how to respond in emergencies. And when we're at, it's the EDDR course that we have created as California specific EDDR course. And in that time, what we do, it's a 2-day course, and we invite the local emergency management agencies into the same room as environmental health. So they all can meet each other, understand their roles prior to an emergency. So that is, it is ongoing here. As you can imagine, 62 different jurisdictions, very different organizations, about half and half environmental health agencies are not located within the health department. So that's confusing also to emergency management. So we're here to support that.
Great. Holly or Dr. Gamble?
I just want to kind of piggyback off what Debbie said. So something here in Indiana that we've been working towards with NEHA releasing the environmental preparedness capabilities. I was so excited because we developed our own crosswalk with our FEP. CDC has our public health emergency preparedness capabilities, and developing that crosswalk. So literally this past week, I just got home yesterday from our Indiana Environmental Health Association conference, where Jesse with NEHA presented on it. And then he and I had a breakout session too, on how do we, and I think I have I know I have a passion for it because I was an environmental specialist and preparedness coordinator for so long that it just makes sense to me. And trying to break down those silos within local health departments of, if you are the preparedness coordinator, do you know your environmental health specialist needs? And if you're an environmental health specialist, do you know what the preparedness coordinator does, other than just has you get on a call down drill or participate in exercise or bugs you to take a training? So it's something we're really striving for in Indiana, is breaking down those silos. And I feel like through our IHA, through our Indiana Environmental Health Association, that is our path forward of getting everyone on page, because everyone needs each other. They'll all lean on each other. How do we make incident command more, the ICS structure more relatable to public health? And so that everyone, even if you don't like ICS and your eyes glaze over when you hear the word NIMS, you're understanding that it's the framework. And to Dr. Gamble's point, it's the structure that's needed during chaos. Yeah, that was something I just wanted to add it on that.
Yeah, completely. And I am very passionate about environmental health, especially when it comes to emergency preparedness, because sometimes I'm amazed that they don't even know what environmental health does. They don't understand the capabilities. So it's always important to understand that prior to an emergency. I think maintaining relationships, creating them first and then maintaining them is very important. I did want to mention that California is a home state, so I'm not sure about other jurisdictions, but in California, local emergencies begin locally and end locally. And so that is something I don't think even the locals sometimes understand. They go through all their disaster working trainings and ICS, but there is that structure that they need to follow. So that's also another gap that we're always working on.
Derek, Mike?
One thing I want to mention, kind of where the rubber meets the road, is our environmentalists went into the to the disaster area and worked with the homeowners. A lot of people know they need to say, call their insurance company and say, my house blew away, but they didn't remember that they have a septic system under the ground that was also damaged. And we felt like we needed to make sure they understood that, or they were going to have a big problem when they didn't get that as part of their insurance settlement. So we tried to connect with each homeowner and property owner that we could, explain to them what was going on, see what they needed. We gave them letters for their insurance companies, letters for FEMA, trying to make sure that did not get forgotten in the grand scheme of the problems.
Great. This one is for Deborah and Dr. Gamble. Can you describe what type of alerts and warning communications your community uses? Deborah, you want to start?
Well, this is an interesting one. I know that locally we have a local communication system. It's really dependent on the emergency officer within each jurisdiction. They will decide what type of system to use. They're all pretty much the same. We just had an exercise where I lived where I got an email, a text, and a phone call. But it is something that you have to opt in. So they're very good about reaching out. On the state level, we do have the California Health Alert Network, CAHAN, and that is administered through CDPH and our Center for Preparedness and CPR, Center for Preparedness and Readiness. So and response. And they're the ones who administer that. And that is also a system that you opt in. Any health professionals can opt in and receive those notices as well.
In our area, it's mostly rural, so the city has tornado sirens, but those don't reach out into the rural areas. So we're starting to push, weather radios would be a better option for people. And in this particular situation, I would credit several lives, many lives probably being saved, because the TV weatherman in the TV station, he actually went on TV and said, this is a real tornado. And there was something about how he did that really impacted people. I heard lots of stories from wives that were trying to get their documents. And they said, my husband never goes to the basement, but he did that night. Similar kinds of stories over and over. So there was something about that TV weatherman that night that really changed people's perspective.
Deborah, how do you address issues such as water and soil contamination, debris management, and air quality after a large disaster?
So again, we work from local up. And so once the public health officer declares an emergency, then that will activate a regional response if the local capabilities are overwhelmed. And what local environmental health specialists often don't understand is during their everyday regulatory activities, they don't think that they may be sampling water from water wells, but during an emergency, they may be asked to do other sampling. And so that's something we also teach in our EDR. So we're always constantly preparing them for the idea that you may need to wear different hats during a disaster. So name of the game for us is preparedness.
I'll open this one up to everyone. How do you prioritize distribution of resources such as food, water, medical supplies, and who would decide that in your jurisdiction? Holly, do you have thoughts on that?
I know that, and to your point, Debbie, with California being a home state, we are as well. Everything begins and ends locally. So if it was local resources, obviously that's going to fall into their local plans. But then at the state level, if there was something they were requesting from us and it was multiple counties, it's going to be the most impacted that's needing the resources. I mean, we would go through our policy group at the state to determine where those resources would be allocated based on the situation and all those components. I don't know if Derek, you have anything that you'd like to add into that?
Yeah, I'll add, Holly. And I go back to sort of our basics of like medical countermeasures distribution and allocations for scarce medical supplies, and really just defining and querying your access functional needs, population disproportionately impacted, and with the goal of reducing morbidity and mortality as sort of our goal when distributing assets and resources. And just looking to our executive policy group to really follow those principles.
All right, this question is also for everyone. In the middle of a disaster response, how does your own team manage their personal, mental, family needs, etc., while acting as a local responder? Derek, you want to start us off on that one?
I'll say, at least for me personally, I remember not this tornado, but the other severe weather incident where called in the middle of the night. I think it was like 9 o'clock at night. And then the shifts were relieved at 7 a.m. that morning. And just me knowing that my staff were trained to backfill my role made me feel more comfortable and able to relieve myself and rest that day to then go in for the next night shift. So just really knowing that we had a cross-trained team there to support me sort of helped me be more relaxed.
Dr. Gamble?
In our situation, our emergency management agent was actually out of town, but he came back right away. But his house was one of the damaged houses. So he was one of the victims to this disaster. And so the other EMAs in local counties actually helped run the EMA office because to give him some assistance. He was present, but he also had to deal with his personal issues. His house was blown away and his wife was in it when it happened. And so the commissioners, the county was very supportive of him to take as much time away as you need. What can we do to help you? And we had a lot of assistance from other counties that came to help him as well.
Deborah, you want to jump in?
Well, this is interesting because we're modifying our EDR awareness class currently, our California EDR. This is one of the most requested modules currently, is how to take care of yourself. So environmental health understands that it can be very stressful under everyday circumstances, but during a disaster, that is multiplied. And so we teach the psychological first aid, how to recognize your own person, how, what your boundaries are when you can feel like it's too much and what works for you, because everybody's going to be unique. It is important because if the disaster service workers aren't available, the community is not going to get up and running sooner than it could.
Paula, do you have anything else?
I think exactly to kind of Derek's point, knowing that we have built up a team and that I can end that shift, knowing that I have a well-trained team that I trust, and that we have that backup. You can leave that shift because your adrenaline's high, and everyone feels like, well, I can't just go home and go to sleep because then you feel guilty. Then you have that part of it. But knowing that you have that well-trained staff, that it's okay to go home and to take care of yourself and to sleep for a little bit, and eat that snack and go to bed and get rest so that you're taking care of yourself, so that when your shift comes up again, you're fully charged, your batteries are charged. So I think the biggest thing is recognizing, and sometimes that's just experience after you've went through things like this for a while. Sometimes it's age, who knows, where you really realize the importance of keeping your batteries charged. And it's okay to take that break when people to tell you to take that break. You're not a superhero. We're all superheroes, but we don't have those. Our adrenaline and our energy levels won't sustain us, and we're no good to anyone if we're showing up with half-charged batteries. So
I wanted to touch back real quick. I'd asked earlier about prioritization of distribution of resources, and I'm wondering, with everyone's increasing focus on equity, if you've made any changes in your plans with that through that lens, I guess. Derek, you have any thoughts on that?
I will say that at least for us in our division, we've hired a health equity and diversity specialist to really help us through our response and planning efforts, and really leveraging more data informed decisions behind the work we do. I will say from like HHS ASPR, the Administration for Strategic Preparedness and Response, they have the Empower data, which takes Medicaid, Medicare data for people,
Oh, you're breaking up, Derek.
individuals on electric powered medical, aware of just making sure that we are aware of people on these medical devices in the community, and local health departments and the healthcare coalitions are. And I know we've even recently did some extra planning with our healthcare coalitions on dialysis facility considerations and planning. So really just making sure that whole healthcare service delivery is able to support people disproportionately impacted by emergencies.
Great, thank you. Well, I think we are ready to go to the question and answer session now. Samara, are you in agreement?
Yes, that sounds great. We do have some questions that were dropped in the chat that I'm going to just read out loud. And we're going to go just in the order that they were shared. So our first question was, it was from Lindsay, and she's saying that she's assuming that this incident resulted in your community utilizing a unified command. Was the health department included in that process right away?
Yes, our health department was included, but it's a small community. So my septic environmentalist was a fire chief doing search and rescue, and his wife is the ambulance service director, and she's the health department emergency preparedness coordinator. So just by nature of a small community, we were involved, but she was actively at the command center the first night and the first day, and she was she checked in there every day thereafter and was involved.
Do any other panelists have any insight into that? No? Okay, thank you. This next question might be directed more towards Dr. Gamble. They're interested if they can be shared the slideshow that you had shared some more information on it.
Yeah, that's fine.
Okay, thank you. We have another question directed towards everybody. They're emphasizing that breaking down silos are so important when we're working in a disaster, and many tabletops are more mass clinic based. Does anybody have any suggestions for environmental health specific topics for tabletops that they have used in the past or currently use?
I can take a stab at it first. I know something we've talked about is even like a Legionella type scenario. But then something we've used real world most recently, we had a food recall where our food protection division director reached out to our preparedness director and was like, I need your help, and calling all these local health departments to ensure that this product is off the shelf, because it was the second time around FDA food recall and they were finding it was still on the shelf. And we're like, oh, okay, so preparedness was being involved. And so that sparked us of like, how can we do a more tabletop? How can we get out of our, to your point, Sarah, of the mass clinic? You know, we worked so hard for so many years. Everything was anthrax based. And then we finally got to, you know, after H1N1, things more of a prophylactic and a different modality. But because that's how we get our partners to the table, our partners at the local health department, our partners within our division or within our commission, of the importance of that tabletop. So they're not just showing up and thinking, okay, this is something else I'm having to participate in. I'm actually taking something away from this. So whether it is that there's a food recall I do know that, and Samara, I don't know if you want to speak to that, or Jesse may has more info, but we're really excited about this AI tabletop simulator that will be being released soon from NEHA. I just found out about it this past week, and that was wonderful. But yeah, and you know, there's always a traditional tornado of the scenario of getting your environmental health specialists involved. To Dr. Gamble's point of, you have the heavy equipment coming in and cleaning the homes, but what does that do to your absorption field? You know, those talking points. Derek, I don't know if you have anything further you'd like to add, but
Yeah.
go ahead.
I do feel like, at least from the federal level with CDC, the next 5-year performance period of the FEP Cooperative Agreement is definitely a little more intentional towards the inclusion of our environmental health colleagues in that. And I know, at least from the exercise framework, we of course have biological, chemical, nuclear radiation, and natural hazards as being sort of those exercise keystone that we can exercise towards. And then of course our capstones that are risk-based based on our jurisdictional risk assessments. So definitely, I know my team's at least being a little more intentional in thinking how we can include environmental under those different components, whether it be radiation or a chemical release, or even just a natural hazard, such as like an earthquake or a tornado.
In California, for our EDER class, we developed a tabletop exercise that was based in real life, that a lot of times emergency responders don't think about. And it was a situation, very rural county. Fire crews were working up there around the clock, and they had a base camp where they had a GI bug going through. And the health officer called up the environmental health director. I believe she only has 5 on her staff, so there's not a lot up there. And she went out to take a look. They were really suspecting that it was the caterer, the food person. But when she went up there and started looking around, she found that the main water source from the camp was a dirty hose that was connected to an abandoned water well that nobody knew anything about, but they thought, cool, water. And so they connected. The caterer was using it, the shower systems were using it. So she was able to get a water source, clean water source for them, and of course, helped with that. So we use that actually as a tabletop exercise, and also sometimes as an inject, just to remind the emergency responders that it's not just, you know, community is very important, but it's also those first responders we need to protect.
Great. Thank you so much, everybody, for answering that question. Kind of going off of what Holly mentioned about NEHA's disaster readiness simulator, I did drop that into the chat, so everybody has the link to that. It's going to launch later this fall, but we, as NEHA, developed the simulator to offer a different approach for preparing for the reality of, you know, responding to concurrent disasters. It's meant to enable different organizations so that they can accurately test and understand their own emergency response capabilities and their capacities. The link is there, and it has a very nice explainer video, and you can sign up to be notified when it launches so that you can participate in it. We're very excited for that. We do have another question that I do want to address. We just have a few minutes left. But wondering if all of our panel members could possibly share a unique experience that you had and a lesson that you learned that might influence how you respond to future disaster events.
I just have another quick example of within an EOC, the safety officer was letting the group know about potential dangers when they were going out to do their site assessments. These were after fires. We're looking for household hazardous waste. Primarily, it was phase 1 debris cleanup. And they mentioned the septic systems, and I know septic systems have been mentioned a couple of times here. But sometimes the local jurisdiction doesn't have records. And sometimes the homeowners don't know where their systems are located. So there's a real disconnect there. So just alerting the the first responders that there are septic systems in this area. And I happen to mention there could be more than one septic tank. And everyone was kind of taken aback by that. Like they didn't know that that was even a possibility. So not only is it important for just the operation of the system to understand what's there, but also for the safety of the first responders, that sometimes the knowledge base of these components or these utilities are with environmental health. And so they need to understand that we do have some information that could be more broad than just protecting the community or recovering the community recovery, but also with the safety.
For us, a couple of unique issues that came up. We have a construction debris only landfill, and our commissioners, our workers did a great job clearing stuff. They did it too fast before FEMA gave the okay, and that was a problem for us. So don't make that mistake. But they filled the landfill, and they had to open a second cell, and that is very, very costly. And they had not planned to do that for several years. So that is going to be a big issue ongoing for our county financially, because they don't have the money for the second cell, and that was a big issue. And then just kind of a poignant, unique thing is somebody decided, these people don't have anything. They're going around picking their stuff out of the field. It's going to rain tomorrow. So they brought in plastic totes from places, even like one of the companies shipped a truckload of plastic totes. And they passed these out to people so they could pick out of the debris things that were important to them and put those in the plastic totes so they'd be protected and have a way to move them. So just something simple like that can actually have a really, really big impact emotionally on your people.
Got a couple that come to mind, both from both hats I've wore. One is just also keeping in mind when you're going out, if it's after an event, and you're representing your local health department or whoever, and you are doing those inspections, your tone and your manner, emotions are very high. So when you're having to tell that non-for-profit who has showed up and is, they're there, that, and they're wanting to serve, and you're telling them of you need to wear gloves, and let's check your temperatures, that you're doing it in a manner because their emotions are high. It's their community, it's been impacted. Your emotions are high. That's some lessons learned. I put in a presentation from another county several years ago that lessons learned from a feedback. So just your tone when you're out in the community. These people have whether their home was impacted or not, their community was impacted. I mean, my home is clear on the side of state of Sullivan County, and when Sullivan County was impacted, you're still these are my friends, these are your people, and it just keeping that in mind when you're going out to speak with them. Another thing I wanted to bring up is something that just most recently Derek and several of our team members went to the operations section planning chief course. And through that course, it was so great. We had hands-on ICS forms for that 3 or 4 day course. And it reminded me of the importance of ICS forms. And, going back to even COVID strike team days, saying, wow, my life could have been a little bit saner had I used those forms. So that's something I know here in Indiana, we're really going to be bringing back to getting those trainings back in the hands of having local health departments sitting down and fill those forms out, and the importance of it, because it really can make your life a lot more saner. And at the end of the day, they're the FEMA forms. You're not having to transfer info onto another form. You have it done. So.
Yeah. And I would say for me, it's just really having redundancy to our communications and information sharing. I know all of us experienced either personally or professionally CrowdStrike recently, even, and I'm sure that all taught us to make sure we have redundancy in how we have situational awareness, whether that's hospital staff or just the operability of services delivered locally.
Okay, great. Thank you so much, everybody. I'd like to say a special thank you to our presenters as well as our SMEs who took some time to share their insights to disaster response. I am going to share just our final closeout slide with everybody. This slide was presented and prepared by our NEHA Preparedness Committee. I've also shared our email, preparedness@neha.org, as well as my own NEHA email. If there's any questions or inquiries, please feel free to reach out. The webinar is being recorded, and I can share that with everybody who's interested. And there's also links that they were also dropped in the chat during our webinar, but to our readiness hubs, our EFEPR capability framework, and then also our launch of our disaster readiness simulator. So thank you everybody so much for attending today's webinar. I really appreciate it. And I'm so glad that everybody had the opportunity to share, interact, and ask questions for our SMEs. I hope everybody has a great rest of their Thursday afternoon.
Thanks, everybody.
Thank you, everyone.